Some people who have survived coronavirus may have an entirely new health battle to fight. News Channel 2's Kirk Tupai tells us about the symptoms surrounding the illness.
People who've contracted the coronavirus have developed a wide variety of symptoms, and while there are treatments that are working, it doesn't mean the patients are going home well. Jim Smith is a professor of the physical therapy department at Utica College. He talked about the first stages of COVID-19.
COVID-19 is having impact in some people, a very severe impact on their central nervous system. Others, it tends to affect the organs. But all of those collectively are impacting people in ways that are very physically threatening. When they land in the intensive care unit,
once you've recovered enough to leave the ICU, your body isn't necessarily better. So patients who've already experienced having COVID-19 may have an entirely new obstacle to overcome. It's called post-intensive care syndrome.
The post-intensive care syndrome, which we see as the next public health crisis that we're going to deal with around COVID-19 pandemic.
Jim Smith has been working with health officials about what they may have to prepare their patients for once they've recovered from the initial symptoms of COVID-19.
They're going to have physical problems such as decreased functioning, weakness, their difficulty walking. They're going to have mental health problems such as anxiety, post-traumatic stress disorder, and depression. And they're going to have cognitive problems with poor clarity of thought.
Smith tells me it may take years for some patients to overcome the physical and mental traumas, but also says there's a simple way to treat many of the symptoms through physical therapy. We'll give you a better understanding of how you can not only fight post-intensive care syndrome, but even prevent it. That's coming up tonight at 6. In Utica, I'm Kirk Tupai reporting for News Channel 2.